So help me again. You were explaining the differences between a compounded weight loss drug and the ones through the pharmaceutical companies. And I thought it was really cute because we call it semaglutide. So the semaglutide is what that person's on. Tell me about that. How do you feel about the semaglutide?
So semaglutide is actually the way you say it. And so semaglutide is very similar to Ozempic and Wegovy, but it's a compounded GLP-1 agonist. When people are saying I'm on tirzepatide, tirzepatide is a compounded form of Mounjaro Zepbound. Not the same. The Mounjaro Zepbound is a brand. Ozempic Wegovy is the brand from the pharmaceutical companies. Semaglutide and tirzepatide are compounded GLP-1s.
So tell me a little bit about that. Those two compounds, I was told by a compounding pharmacy that as long as they're out of the big brands, they can compound them. But when they get them back in stock, they'll no longer be able to compound them. Help me understand that because that was confusing.
The only way that they're able to compound medications is because of the supply issue right now. So you're going to run across a lot of healthcare providers that will not recommend compounded GLP-1s just because there's a potential for safety, efficacy, sterility, and things like that. So just so you guys are aware of that.
So let me ask that question because I worked with so many compounding pharmacy. I get my hormones from them.
Mhm.
I found them to be excellent. I think that there's room for everybody. So from my perspective, trying to push someone out. Now, granted, I get what you're saying. You're saying that the pharmaceutical companies don't want to be responsible for a liability that could potentially happen when there's somebody doing science in a smaller venue that's not necessarily following all the same things that they're required to follow. Is that what you're saying?
Healthcare provider. So for those of us who work for big organizations, if I were to recommend or prescribe a compounded medication and something happens to my patient, I could be held liable because I'm not following evidence-based guidelines. So when my patients are taking compounded GLP-1s, I just say, do your research. Do your research on the compound pharmacy, on their supplier, and make sure that they're following FDA guidelines.
Okay. And how do you feel about that personally? I'm just curious. Like, what's your perspective?
I understand it's an issue because it's really expensive and a lot of people don't have coverage for the brand name. So I just tell my patients proceed with caution. So I
Okay.
have a lot of patients doing it and I know that and I don't blame them because of the cost issues. I just worry about safety.
So is it cheaper to do it through the compound than it is through the pharmaceutical company?
Sometimes. So if people don't have coverage, so if their insurance doesn't cover these, it can be very, very expensive. And so many times the compound pharmacies are cheaper. Now there's a lot of places that are prescribing them and they're making a lot of money. So it just depends on where people are getting them, how much that provider is charging, how much all that kind of stuff.
Excellent. And is there one particular that you like to promote or no? You don't have a specific one.
I don't promote the compounds.
Got
So
it. Perfect. Thank you.